This conference will now be recorded.
In June, go to India. Hello, yeah, good morning to everyone. Today the class is on septic arthritis. Hello, is it audible?
Yes, sir.
Yeah, fine. Okay. So today topic is septic arthritis. Okay, septic arthritis. So septic arthritis is nothing but infection. Okay, first thing is infection of the joint. Here septic is sepsis. Okay, it tells about the infection. Whereas arthritis is inflammation of the joint. Arthro itself indicates it's a joint. Okay, and what is the difference between cellulitis and septic arthritis is? So cellulitis is infection of a bone. Okay, means it may be around metaphysis or diaphysis, like that. So around this area. Okay, but the infection which comes into the joint is known as septic arthritis. Okay, so what is the importance of septic arthritis? Here it will affect even cartilage. If it is sorry, not cellulitis, what I told osteomyelitis. Okay, the difference between osteomyelitis and septic, the difference between osteomyelitis and septic arthritis is osteomyelitis is infection of the bone marrow. Myelo means marrow. Okay, infection of the bone marrow, and by itself infection of the bone. Okay, it is the infection of the bone. There is no involvement of cartilage. It may be at the diaphysis area, metaphysis area, or even here, but it doesn't involve cartilage. The septic arthritis importance is it involves the cartilage. So joint is lined by synovial synovial membrane, joint capsule, and cartilage. So the cartilage is also got affected here. Okay, so this is joint capsule, this is synovial membrane, and this is cartilage. Okay, and here we'll have synovial fluid. So that is the difference between osteomyelitis and septic arthritis. So osteomyelitis is infection of the bone, whereas septic arthritis is infection of the joint. So the difference is here cartilage and the synovium, everything is involved, but here only bone is involved, osteomyelitis. So septic arthritis is inflammation of the synovial membrane, due to which there is purulent effusion into the joint capsule due to infection. So 50% of cases, most commonly the affected people are very older age or very lesser age. Why? Because these people are mainly immunocompromised. So the septic arthritis will come in the immunocompromised people or even diabetic people. So those who have less immunity or who on steroids or who are any tumor condition patients. So those patients in which immunity is less, like in HIV, okay, these people will have the septic arthritis infection. Okay, main immunocompromised. And the septic arthritis importance is it is medical emergency, so we should operate it immediately. Why? Because the septic arthritis, it even leads to sepsis. Okay, because the infection, particularly it comes to the immunocompromised people, so naturally already his immunity is suppressed. So when there is a infection within the joint, it will spread it through the blood into the whole body, so due to which it leads into septic shock. So therefore it's a medical emergency. We should operate immediately, and we should do arthrotomy, and we should remove whole pus, we should debride the synovium, everything. Okay, so failure to initiate appropriate antibiotic therapy within the first 24 or 48 hours of onset can cause subchondral bone loss. So subchondral is nothing but that cartilage. So cartilage will be eaten away by the infection, and then the subchondral bone, and loss of permanent joint dysfunction. The importance of here, why should we be hurry? Why it is emergency is because it will go into sepsis shock. And another thing is, if it is advanced, if septic arthritis advanced, and the joint will get damaged, that cartilage will get damaged, and due to which there will be loss of movement. Okay, it may be knee joint or it may be hip joint, there will be loss of movement. Ultimately patient will cannot walk. So that is the main problem. We have to intervene as early as possible to prevent septic shock and also to prevent joint arthritis. Okay, then it can cause septic shock, which can be fatal. Okay, septic shock is very fatal. Sometimes people will die if he is more immunocompromised, like diabetics. Okay, and any on chemotherapy, so these people are more prone to die. Okay, so therefore we should be intervene. Septic arthritis is an emergency procedure. One thing is it leads to septic shock, and another thing is it leads to arthritis of the joint due to where there is loss of movement of the joint. So first we will go for anatomy. Okay, so these are the bone. Okay, say anytime the joint will be around the epiphysis. So this is epiphysis of suppose think it is a knee joint. Not only knee joint, it can affect any joint. For suppose think it is a knee joint, it is femur, it is tibia. So these are epiphysis area, and here we have cartilage. Okay, here we have cartilage, and this whole thing will be lined by the synovial membrane. So what is the importance of synovial membrane is there will be abundant blood supply here, and through the synovial membrane there will be secretion of the synovial fluid. Okay, it is like a ultrafiltrate from the blood. Okay, this what is the importance of synovial fluid? It creates a lubrication, okay, for the free movement of the joint. It's just like a small ball bearings in which we pour oil. So this synovial fluid is very viscous, very thick, so it provides a viscosity due to which there will be free movement of the joint. Okay, so that is the importance of the synovial membrane. Okay, so and this is joint capsule. This pink color one is joint capsule. Okay, so this is the structure of every joint. So whenever it get infected, so first the thing which get affected is the synovial membrane. Okay, it will get hypertrophied. So first we will see the anatomy. Okay, so this is synovial membrane, this is articular cartilage, this fibrous joint capsule, and it is synovial fluid. Okay, that's it. Okay. Then so there is each and every joint can get affected, but most commonly is the knee joint. Okay, so any joint can get affected, wrist joint, elbow joint, shoulder joint, whatever, any joint can get infected, but the most common joints which get infected are the knee. Okay, knee joint is more prone. So generally most of the times whenever any patient come with knee swelling, so first thing which we should knee swelling, local rise of temperature, any fever, so first thing that comes to any orthopedics patient's mind is the septic arthritis only, because it is very, very important. We have to rule out septic arthritis. Okay, then hip, elbow, shoulder. Okay, any joint can get affected, but most common joint is knee joint. Okay, so what is this infection? The prevalence of bacterial arthritis is diagnosed among adults presenting with one or more acutely painful joints. Okay, all age groups, any age groups, but most commonly the infants and the older adults, because these were the more immunocompromised. Okay, these lesser age and the older age are the people who have less immunity, and the young people will have the more immunity. Okay, the knee is most commonly affected. Okay, and so what organisms? Okay, it getting infected with what organisms? Most commonly bacterial organisms, and the most common organism is Staph aureus. Okay, remember the most common organism for septic arthritis is Staph aureus. Okay, but particularly as depends upon the age group, there are different organisms which are specific to that age group, like in neonates, Streptococcus and gram-negative. In infants, Staph aureus, Haemophilus influenzae. Children, but recently this Haemophilus influenzae is very less, because many children were getting hib vaccine. Okay, because of which this infection is less these days, but most common ultimately is the Staph aureus only. Okay, then adolescent Staph aureus is gonorrhea. Gonorrhea is previously due to sexual infections, but now it is also less. So adults, so if you see everywhere there is Staph aureus, so most commonly Staph aureus, except neonates where there is streptococcus. Okay, then IV drug abuse, particularly they affect with pseudomonas. Okay, remember it is also PCP with pseudomonas, IV drug abuse. Okay, so this is the okay, so bacteria is infecting our joint. So how it is entering, how the bacteria is entering inside? Okay, so it may be entered through blood. See, first number we can see hematogenous spread. Okay, see blood there will be, so bacteria is present constantly, but those who are immune, like young people, okay, and good nutritious people, this bacteria can't infect the joint. But those who are very less age, are very older age, are diabetics or immunocompromised people, they can't combat the infection. So therefore that bacteria coming to the blood will go into the synovial membrane. First that synovial membrane will get affected. Okay, later we'll see what happens in pathogenesis. So this is first is hematogenous spread and direct trauma. See, sometimes there may be open injuries. Okay, open injuries over the knee and the knee joint, patella, everything may get exposed. So at that time what happens, that soil, that bacteria present in the soil may enter inside. That's why whenever any joint is there is open injury, it should be debrided with abundant saline. Okay, we should clean it thoroughly, we should remove whole dirt, we should debride it properly as early as possible, so that joint doesn't get infected. Even if bone gets infected, of course if bone gets infected there is issue, but other than bone, joint is very, very important, because it leads to septic shock, and other thing is it leads to arthritis, because of which there is loss of movements. Okay, so direct trauma and aspiration injection. See, so many times whenever a patient comes with knee swelling, the first thing which we'll do is aspirate. We'll aspirate the synovial fluid, and we'll send the synovial fluid for the synovial fluid analysis to get the diagnosis. So at this time we should be very septic. Okay, we should spread one sterile cloth. Okay, we should wash the skin with full betadine, antiseptic solution, everything. Why? Because there will be much abundant bacteria over the skin, so it should not enter through the puncture site. So we should not infect the joints, therefore we should clean thoroughly. So therefore, well, aspiration knee aspiration. Whenever there is swelling, knee swelling, we will aspirate the synovial fluid to send for synovial fluid analysis. So at that time we should be very careful, and we should give proper wash before inserting the needle inside the joint. Okay. And osteomyelitis. So osteomyelitis we have said before. Myelo means marrow. Okay, infection of the bone marrow. What happens? It may spread through the bone into the joint. At sometimes when if it affects the metaphysis, particularly at this area. If it is a diaphysis, most will not go. But if it affects osteomyelitis, it may the bacteria may lodge inside. If it is osteomyelitis is very severe, it may lodge inside the joint. Okay, osteomyelitis. Another thing is inflamed extraarticular structures. Okay, so like this. So it may enter in any form. So bacteria is entering inside. Okay, it entered. Then what happens? So we'll see in the pathology what happens after entering. Okay, so entering may be due skin infections. Even some skin infections, they may ulcerate. Those skin infections over the knee joint may ulcerate, and they may enter into the knee joint. Sometimes skin infection may be at remote area, but that infection spreads through the blood. That is hematogenous spread. Okay, contiguous spread is directly at the knee joint or a hip joint. That skin may get infected, may ulcerate, and the infection may go into joint. A direct inoculation, that is intraarticular injections. Okay, and any prosthetic joint. See, particularly TKR, total knee replacement, total hip replacement. If you have not done under septic conditions, if while doing surgery, if you are not very septic, they may go into septic arthritis. Okay, then hematogenous spread like diabetics, HIV. Okay, immunosuppressive people, hematogenous spread, immunosuppressive, IV drug abusers. What organism is most common IV drug abusers? It is Pseudomonas. Okay, like this. Okay, so and the sexual act is gonococcal infections. Okay, particularly age older than 80 years or less than 4 years. And predisposing factors. Some predisposing. These people who have these conditions are more prone for this septic arthritis, like rheumatoid arthritis, SLE, because these people in rheumatoid arthritis and all will start with so many tablets like methotrexate and all. Okay, and SLE also will use steroids. So these also will cause immunosuppressive drug therapy. Okay, diabetes, immunodeficiency disorders. Okay, then chronic liver failure, renal failure, like this. Why renal failure and all is because the patient will be under stress. Okay, naturally there will be less immunity. When we are in stress, what happens? They will be increasing, the steroid hormones will be increased. Okay, so naturally there will be less immunity. Okay, so what happens? Somehow bacteria entered inside the joint. So once it enters inside, if you have the proper immunity, like in young people, if you are not diabetic, if you are not an immunosuppressive therapy, we can combat the infection. Okay, but if we cannot combat the infection, if we cannot combat the infection, like older people or any diabetic people, immunosuppressive people, what happens? The synovial membrane will get affected first of all. Okay, because synovial membrane is the one which is lining entire joint. So whenever the synovial membrane gets infected, see, whenever there will be inflammation, itis. Whenever there is inflammation, what happens? We have dolor means pain. Okay, then swelling like tumor. Okay, calor means increased rise of temperature, like this. So there will be swelling of the synovial membrane, there will be hypertrophy. So whenever there is inflammation, there will be increased blood supply. So naturally what happens? This synovial membrane will increase in thickness, it will get hypertrophied. So whenever it get hypertrophied, what happens? The secretion which it releases will increase. So naturally there will be more amount of synovial fluid, and the synovial fluid is infected by bacteria. So naturally it will be in pus. It is almost like a pus. So normal synovial fluid, there will be around 15 ml. So now there will be, it may be some 20 ml, 50 ml, 60 ml. Okay, sometimes even 90 ml. So that amount, that synovial fluid will be converted into pus due to this bacteria. Okay, so pathogenesis is immediately when bacteria rapidly gain access to the joint cavity and it settles in the synovial membrane. Okay, first it will affect the synovial membrane, then acute inflammatory reactions will take place. Whenever there is inflammatory reaction, what happens? There will be pus formation. Instead of secretion of synovial fluid, that synovial membrane will be secreting the pus. Okay, there will be pus will be coming. Pus is nothing but there will be multiple lymphocytes, white blood cells, everything, debris. Okay, so articular, and what happens after synovial membrane? So first that synovial membrane will get eroded. After synovial membrane, what layer we have? There is cartilage. So then the cartilage will be eroded. After cartilage, there will be subchondral bone. Then the subchondral bone will get eroded. Then there will be loss of joint membrane. There will be arthritis of the joint. So therefore, before entering into all these stages, we should intervene as early as possible. That's why it is an emergency. So when arteries gets eroded, it gets destroyed by the bacterial toxins and enzymes released from the synovial and inflammatory cells. In late cases, there will be erosion due to synovial proliferation and ingrowth. Okay. If untreated, it will be spread and there will be abscess formation. There will be sinuses. Okay. If the patient can combat the infection, it may decrease. If we can't combat the infection, there will be no complete resolution. There will be fibrosis. There will be loss of cartilage. There will be loss of articular cartilage, and there will be arthritis. And sometimes, if if patient was survived, there is no septic shock. What happens is ultimately this whole cartilage will be removed. Due to the removal of the cartilage, the subchondral bone of both sides will attach each other, and there will be bony ankylosis. Ankylosis means attachment. Okay, there will be no free movement. These both bones will join together. That's known as bony ankylosis. There is also something known as fibrous ankylosis. If the bacteria is tuberculosis, okay, tuberculosis is entirely separate entity. In tuberculosis, there will be fibrous ankylosis. Means there will be fibrous tissue around here. There will be no cartilage. There will be no sinus fluid. There will be no sinus membrane. There will be only fibrous tissue. So in tuberculosis, there will be fibrous ankylosis. Whereas in normal bacterial infection, it will be bony ankylosis. But there is it is reverse in case of spine. If in spine there is affection of TB, there will be in spine there will be TB bony ankylosis and normal sepsis fibrous ankylosis. Okay, just reverse in spine. But naturally TB will go into fibrous ankylosis and normal other bacteria will go into bony ankylosis. Understood, right? Bony ankylosis means these both bones will join together. Okay, because there is no cartilage, there is nothing here. These both bones will mix up. Okay, they'll become one long joint, and there will total loss of movement. Okay, so this is the different stages. What happens in early stage? There is acute synovitis with a purulent joint effusion. Okay, there will be acute synovitis, whole synovial membrane will get affected, and literally there will be increase in the joint space. Initially, what happens is joint space will be increased because this cartilage will get eroded and fluid will increase. That purulent fluid will increase here surrounding. So therefore, the joint space will increase. Later, due to arthritic changes, after cartilage is gone, there will be subchondral bone. When subchondral bone got exposed, there will be arthritic changes, and will loss the joint space will be decreased, and at last it will end up with ankylosis. So this is ankylosis. Whenever subchondral bone is exposed, these both bones will join together to form a bony ankylosis. But in TB, there will be fibrous ankylosis. Okay, in early stage, there is an acute synovitis. Then soon the articular cartilage is attacked by the bacteria. Then infection is noticed. The cartilage may be completely destroyed, and then it will become ankylosis. Okay, at last. Sometimes there will be dislocations and subluxations also. So how to diagnose it? Patient came to you. So what happens? First of all, he will come with knee swelling. Okay, that is obvious, and there will be local redness. Okay, see, as compared to other anytime we should compare with the other, because we had two limbs, two upper limbs and two lower limbs, we should compare with the other one. See, here there is a known as parapatellar fossa. So here if you see, the parapatellar fossa are missing because there is swelling, there is accumulation of fluid. Here there is no parapatellar fossa, and here patella is seen clearly, but here patella is not seen clearly because due to swelling, due to accumulation of the fluid. And you can see the skin color here, it is very red because of inflammation. You know, right? Inflammation. Calor. Okay, so calor, rise of temperature. Robur, this is robur. Okay, the inflammatory is 5 cents, you know, right? Robur, calor, dolor. Okay, and so because of which here there is redness. Redness is robur. Okay, as compared to other joint, there will be redness here, and patient will have fever due to bacterial infection. There will be fever, pain over the joint, and pseudo paralysis. What is pseudo paralysis? Because of severe pain, the pain will be very severe that patient cannot flex his knee joint. So therefore, he cannot move the whole limb. So it appears like it got paralyzed. So patient will come with severe pain. See, in other conditions like in rheumatoid arthritis or any inflammatory, non-inflammatory arthritis, there may be severe swelling, but in that there will be no pain. Patient can flex his knee. But here in septic arthritis, patient cannot flex his knee. Okay, remember, patient will come with fever, local rise of temperature, swelling, local redness, okay, and there will be severe pain that patient cannot move his limb. That is known as pseudo paralysis. Okay, like this. See, fever, joint pain, swelling, pseudo paralysis. And in children, they will be very irritable. Okay, particularly in children, there will be hip arthritis. Okay, what happens? They will be very irritable. They will be warm. Okay, tenderness, rapid pulse. Okay, then like this, and they will not feed. Okay, they will not eat anything, and they cannot move the limb. And see, if you see this hip is in position of flexion, abduction, external rotation. So here there is hip flexion, there is hip abduction. As compared to this limb, if you see, there is flexion, abduction, and got externally rotated. Why? Because whenever any joint gets affected, there will be accumulation of fluid. So to accommodate the fluid, we'll keep the joint in a maximum volume position. So this flexion, abduction, external rotation is a position of maximum volume of joint space. So that's why it will be, so every joint will have its own specific position of maximum volume. So this is the characteristic position of to keep it in a maximum volume, not only in septic arthritis, even in transient synovitis, whenever there is accumulation of fluid. Okay, so they will be in a position, this is position of ease also. Okay, so that here capsule will be relaxed in this position. Okay, so local signs of local inflammation, like local redness, okay, then swelling, local rise of temperature, tenderness. Okay, tenderness. What is difference between tenderness and pain? Pain is patient will be complaining. Tenderness is when we press, patient will have pain. So that is tenderness. Okay, and all movements of joints are restricted. That's nothing but pseudo paralysis. Okay, and see, joint oriented has to minimize pain. That position of comfort are the maximum volume of the joint. Hip is flexion, abduction, external rotation, as you have seen in the previous picture. Whereas knee, ankle, and elbow, there will be in flexion position. Whereas shoulder will be in abduction and internal rotation position. So these are the different position of ease, position of comfort, or position of the maximum minimal pain or maximum volume. Okay, so that is the position of maximum volume to accommodate the increasing fluid or increasing pus. So patient, when it comes to, we may get so many diagnoses into our mind. It may be osteomyelitis, maybe due to trauma. So the swelling is there, but we don't know whether it is pus or not, because pus cannot be seen, right? There is no sinuses, nothing. So it may be, so only swelling is there. We don't know. It may be excessive synovial fluid. It may be blood. It may be pus. Okay, or it may be some crystals, some calcium phosphate crystals. So that one we have to diagnose later. So, but most of the time septic arthritis we can diagnose clinically. It will be, patient will have fever, patient will localize temperature, swelling, redness, everything. So we can immediately diagnose it as septic arthritis. But we have to keep every differential diagnosis in our mind. Okay, these how to differentiate we can see later with investigations. Okay. So investigations is, we will do blood investigation, X-ray, ultrasound, diagnostic aspiration, and MRI. So in blood investigations, see, whenever there is infection, there will be increasing of white blood cells. Okay, leukocytosis means increase of white blood cells, and particularly there will be more increase in neutrophils. Okay, neutrophils will be increasing because it is an acute infection. See, any acute infection, there will be increasing of neutrophils, and any chronic infection, there will be increasing of lymphocytes. Therefore, TB being a chronic infection, there will be increasing of lymphocytes in TB. But in case of any bacterial infection, there will be increasing neutrophil. That is known as neutrophilic leukocytosis. Overall, there will be increasing the WBCs. Normally, there will be 4 to 11,000, but here there will be more abundant. If you see, there sometimes people will come with 30,000 like that. Okay, and ESR will be high. Erythrocyte sedimentation rate, CRP, C-reactive protein will be high, and blood culture, if we send blood culture, we'll even get the organism which infected the joint. Okay, blood culture will be positive. So by this we can tell that it is infection. So in early stages, usually X-ray will be normal. Okay, but early stages X-ray will be normal, but later stage, what happens? There will be joint space fading because of accumulation of fluid and also degeneration of the cartilage. Later, there will be irregularity of the joint because whole cartilage got degenerated. That's why there will be irregularity of the joint. See, like this. So initially joint will be very fine, but later due to degeneration of the cartilage, so there will be explosion of the subchondral bone and there will be irregularity of the joint. This is known as septic arthritis. Itis. Okay, arthro means joint inflammation. See, normal joint space, whenever there is loss of joint space, it will be like this. But initial means very early stages, there will be increasing of the joint space. Okay, but here at last, this is very severe case. Okay, see, this is the normal joint space. At later stage, there will be, at advanced stage, there will be decrease in the joint space. See, very advanced stage. Total head is gone in hip. This is septic arthritis of ankle, no joint. Okay, got degenerated. Ultrasound. So ultrasound is it is non-invasive and inexpensive. Just by seeing, we can tell that there is what is fluid collection inside. Okay. It can be used to detect even small amounts of effusion can be detected. And clinically, by patellar tap, we can diagnose by patellar tap. What is this patellar tap? Is we hold one hand, okay, we push the fluid underneath the joint, and we will with the fingers will tap over the patella. So because of which we can assess that there is some fluid inside. That patella will be ballotting in the fluid. Okay, that is known as patellar tap. Joint aspiration. What is joint aspiration is? So this is in OPD procedure. So there is swelling. So what we can do is we can see whether it is hematoma collection, whether it is pus collection, or whether it is increase in synovial fluid, just by simply inserting one needle. But before inserting needle, we have to clean properly. We should not infect the joint. And in needle, generally will insert at the this region, soprolateral, not medial side, soprolateral. Okay, superior pole of the patella on the lateral side. On lateral side, we will insert the needle, okay, diagonally underneath the patella to aspirate the fluid so that it will enter into the joint. Early cases fluid may be clear, but sample that fluid will send for microscopy, pathology, and biochemistry. So pathology for knowing the counts, okay, how the neutrophils are. Even in synovial fluid we can see for neutrophils, okay. There will be 90% of polymorphonuclear neutrophilic leukocytes present in the synovial fluid, and leukocyte count will be greater than 50. This is not blood, okay, this is synovial fluid count. Okay, blood count we have seen previously, but here this is synovial fluid count. Even in synovial fluid there will be leukocytes, there will be neutrophils. So these clearly, whenever there is 90% of neutrophils within the synovial fluid, it indicates septic arthritis. Okay, normal synovial fluid leukocyte count will be 300 per ml, but in this there will be greater than 50,000. Okay, so and even it is sent for pathology. So pathology for counts, whereas biochemistry to look for protein, glucose. Why glucose is, in infection what happens is glucose level will be decreased, right? Okay, glucose level will decrease very low. Okay, and for microbiology to stain and to culture to know the organism, what organism infected our joint. Okay, so this is the aspiration from supralateral pole of the patella. We will insert a needle. So here you can see this is like almost like a normal synovial fluid. See, normal synovial fluid, it will be like some like yellowish tinge will be there, okay, and it will be transparent, okay, but it is somewhat turbid, but it is not exactly infection. It may be due to early stages, or it may be due to some rheumatoid arthritis like that. But in septic arthritis there will be frank pus, okay, we can aspirate frank pus, okay, it will be white color. But white color, even in gout there will be white color. So therefore when you send for synovial fluid analysis, in gout there will be crystals, that urate crystals, but in septic arthritis there will be organism on culture. So like that we can differentiate. Okay, so like this we will aspirate. Actually exact site is not here, okay, supralateral pole of the patella we have to aspirate, and we'll send for synovial analysis. Okay, we are sending it for biochem, pathology, and microbiology. Okay, microbiology for culture the organism, biochem for glucose, and pathology for knowing the counts. Okay, so this is color. So by even color also, see, normal there will be colorless, a straw color, that is like some yellowish tinge will be there. Okay, in inflammatory like in rheumatoid arthritis and all, okay, there may be bright yellow. Okay, in sepsis there will be pus. Okay, in hemorrhagic it will be pure. For suppose due to trauma immediately after fall, patient may come with ACL injury. Even at that time there will be abundant swelling, but that ACL injury, in that there will be pure blood. Okay, it will be very red color. Okay, on aspiration itself we can tell whether it is inflammatory. By seeing the color we can tell whether it is due to trauma, whether it is due to infection, or whether it is due to some rheumatoid arthritis conditions like that. Okay, and in counts in septic arthritis there will be greater than 50,000 counts, but others there is very less. If you see 3,000 like that. Okay, so like, and it's a gross appearance. Okay, same thing, yeah, here. So TB, and TB is very important. TB and TB is also bacterial infection, but how to differentiate TB and normal other bacterial like Staph aureus? So TB, it is very turbid and it will be cobweb formation. There is something known as cobweb formation. If you take the synovial fluid into a small container and you keep it aside, later what happens is there will be a cobweb formation on the surface in TB, but not in other conditions. Okay, and both are bacterial infections. Both TB and septic are bacterial infection. Therefore, in bacterial infection, glucose will be low. Okay, glucose will be low in bacterial infections. TB is also a bacteria, but in TB there will be cobweb formation. Okay, and here I told about color previously, and in gout there will be urate crystals. Okay, urate crystals. There is something known as pseudo gout, where it is not due to deposition of uric acid crystals, but it is deposition of calcium pyrophosphate. There will be calcium pyrophosphate in pseudo gout. Okay, like that. And this is something like Kocher's criteria of septic arthritis of hip. Okay, this is the Kocher's criteria to diagnose it is septic arthritis. Temperature will be greater than 38.5 degrees centigrade, and WBC count. This is the blood. Okay, blood lymphocytes, they will be greater than 12,000, and ESR greater than 40, and patient cannot move, and C-reactive protein greater than 2.5. Okay, so this is known as Kocher's criteria. And MRI. Why MRI is, see, we can know the extent of damage. We can know the extent of spread of the pus. Okay, sometimes it may sweep through the muscular planes. Okay, can detect infection and the extent of infection. It is used in diagnosing infections that are difficult to access. Also used in differentiating between bone and soft tissue infections and in detecting joint effusions. So what is the treatment? So what happened? It got infected. So what we have to do? We should remove the pus. So just simply removing the pus doesn't cure septic arthritis, because even if you remove the pus, there is already infected synovial membrane. So that synovial membrane may again secrete pus. So we have to debride it. We have to remove that synovium. Okay, we have to remove that infected synovium from there. And so we have to open the joint. Or recently they are using arthroscope. Instead of opening a whole joint, they were keeping two portals antero-inferiorly, and through the two portals they are viewing, and they were removing the pus, and they were debriding the synovium. So this is arthroscopy, very less invasive. So we have, and initially, see, every septic arthritis initially, if we come at very early stage, we can just aspirate, send for culture, and depending, and we can start antibiotics, we can start IV fluid to prevent the shock. Okay, we can start IV fluid, we can start analgesics for pain, and based upon the culture, we can start antibiotics, specific antibiotics, and it will decrease. It is a very early stage. But in advanced stage with severe swelling and with frank pus on aspiration, better we should either open the joint and clear it, or we can do it through arthroscope. Okay, so broad spectrum IV antibiotics. First line benzylpenicillin, fluvoxamine, augmentin, vancomycin. Initially, because culture will take almost 3 days. Okay, so to get the culture report, it takes 3 days. But before getting culture report, it's better to start some antibiotics. Okay, covering all gram positive, gram negative, and anaerobes. But generally, most commonly, we'll cover the gram positive. Penicillins will cure the gram positive. So we'll cover with gram positive things, or cephalosporins. Okay. So duration of treatment, IV antibiotic we should give minimum for 2 weeks, and in adults 4 to 6 weeks, and in children 2 to 4 weeks. So drainage. So joints that do not respond to antimicrobial. So initially, when if it comes in an early stage, so we have given some antibiotics, we have kept IV fluid, we have given painkillers. Okay, even then patient is not improving, his condition is not improving, his local rise of temperature is not decreasing. Okay, his blood ESR is not subsiding, CRP is not decreasing, counts are not decreasing, then we should go for surgery. Any joint with limb, okay, patient tunneling disease, particular diabetics, these are all people, we should go for surgery. Okay, because if you don't do surgery, what happens ultimately? It may land up with joint destruction. Sometimes there will be pathological dislocation. Okay, osteomyelitis, septicemia, which leads to septic shock and even death. A secondary osteoarthritis, avascular necrosis. Okay. Coxamagny is nothing but increasing the size of the head. That is a different entity, not needed now. Tom-Smith arthritis. This is very important. In septic arthritis, this is a kind of Tom-Smith arthritis will come in infants. So what is the importance? This is also a type of septic arthritis, but that septic arthritis coming in the infant. Okay, why infants are affected with when infants are affected with the septic arthritis, particularly the hip region, what happens is, it is very important that the whole head will be missing. Okay, that whole head will be eaten by bacteria. Why? Because in children, in infants, in less than 1 year, that head is totally made up of cartilage. There is no bone. So this bacteria will eat the whole cartilage, and at last, because he is infant 1 year, that head is gone, and there will be no growth of that whole limb. That whole lower limb will not grow in size. So there will be stunting. Patient cannot walk. Patient will not have head in his whole life, and he cannot walk. So therefore, Tom-Smith arthritis is very important. Septic arthritis of hip in infants should be treated instantly. If you have neglected it, it will come under negligence. Okay, medical negligence, because patient will suffer lifelong. He can't walk with the leg. So therefore, Tom-Smith arthritis is very important, because that infants, if they got infected, his head of I'm talking of not this head of femur. Okay, Remember, head of femur, that head of femur is made up of cartilage, that head of femur will be lost. Okay, so septic arthritis of hip, this Tom Smith arthritis, whenever they ask for septic arthritis, please mention about Tom Smith arthritis. It is very, very important. Okay, septic arthritis of the hip in infants, head of femur. Okay, not this head. Remember, head of femur. Don't confuse. Head of femur is completely destroyed. Okay, so and it will not regenerate. Okay, once gone, it will not regenerate. Okay, so therefore, when head of femur is gone, patient will suffer lifelong, and it is medical negligence. So be careful. Septic arthritis of hip is very, very important. So what happens? Transfacial vessels are present in early infancy before the formation of growth plate. This may account for frequency of septic arthritis of hip in unit. So like this. So clinical features is there will be rapid abscess formation, okay, and complaints of limp without pain. When head is gone, there will be no pain. Okay, shorter hip, there will be leg is shortened. Okay, because head is gone, leg is shortened, and there will be decrease in the growth because physis is also gone. And telescopy test is positive. There is something on telescopy test. Okay, this is not needed exactly, but see, when you hold the leg and will pull it, it will come easily because there is no head. Whenever there is head, yeah. X-ray. In X-ray, if you see, there will be complete absence of head and neck of femur. Okay, and it is a surgical emergency. We should drain the hip. We should remove the pus, and we should start on antibiotics. Okay, arthroscopic drainage can also be attempted. That's it. Thank you. Any doubts? Are you there? Hello?
Yes, sir.
Yes, sir.
Yeah, okay, fine. Class is over. So do you have any doubts? If you have any doubts, you can ask. Hello? Hello? Kalagara అయిపోయిందండి. కాదు అటెండెన్స్ ఏ రిజిస్టర్ ప్రిన్సిపల్ ఆఫీసా ఇది ఆ కింద ఉంది అదే కదా సరే అటెండెన్స్ మీరు తీసుకుంటారు